Testosterone and OSA. Again, one more thing which we should know. Obstructive sleep apnea. OSA decreases the testosterone. With OSA, the people who are having sleep apnea, in them testo goes down, which probably is a defense mechanism. Even in the men, testo goes down, estrogen goes up, because that's how nature is trying to decrease the extent of OSA so that patient can or the individual can be a bit better. But whenever testo is going down, patient will be showing all the features of testo deficiency, right? Now that patient goes to the doctor, and doctor tests the testosterone. Testosterone comes on the lower side and estrogen comes on the higher side. The first thing doctor will be doing is giving the testosterone to the patient and maybe some aromatase inhibitor. As soon as testo is given to the patient, his OSA will go up. So OSA itself decreases testosterone, but testo supplementation increases the OSA. So actually more harm has been given to the patient. The better way to handle these patients is, first is grade the OSA. Okay. If you are willing to give testo, which is not a problem, along with that give CPAP to the patient. Whatever, CPAP, BiPAP, whatever is advised by the respiratory physician. At least you can start from CPAP. So if you give CPAP along with testo, patient will be benefiting more. Or if you are not obsessed about giving testo to the patient, give him CPAP only, wait for a month or two, and then check testosterone, it will come up. In a young man. In an old man, you can very well add up.